It's bigger than biotech.
Hello, and welcome back to another episode of It's Bigger Than Biotech, the podcast where we highlight the stories, strategies, and mindset that go into shaping the future of biotechnology, pharmaceuticals, or the life sciences. Whether you're a student exploring your first career move or a professional looking to pivot into something more purposeful, this podcast is your roadmap. Today, we're joined by someone who has spent his career turning ideas into infrastructure and vision into impact. Andy Wilson. Andy is the Vice President of Business Development for Health Affairs at the University of Southern California, where he is leading initiatives in digital health and AI to position USC as the specialty partner of choice. Well, he's also a general partner at the SoCal Catalyst Fund and the founding executive director of the Alliance for Southern California Innovation, where he helped transform the region into a nationally recognized startup hub. With a background in engineering from Dartmouth and MBA from Harvard, Andy has worn many hats: entrepreneur, investor, ecosystem builder, and a civic leader. Today, we dive into what it really takes to build meaningful innovation ecosystems and why impact and capitalism don't have to be opposites, and what students can do now to future proof their careers in a rapidly changing industry.
My first question to you is you're currently leading innovation strategy in health affairs at USC, and you're also supporting digital health and AI initiatives. What does innovation actually mean to you in the healthcare context, and how do you separate trend from true transformation?
Well, it's interesting as someone who's lived in the innovation world for the last 20 years, mostly in the world of building startups. And now I'm sitting here at USC, and it's a real pleasure and honor to be in the Trojan family. Since this is videoing, I have to do the Trojan. Yeah, there we go.
Fight on.
Fight on. We have a really excellent healthcare hospital and the Keck School of Medicine and a health system with a lot of tremendous docs. But that business is tough and getting tougher. There's a lot of regulatory constraints and reimbursement constraints and challenges around access and cost and quality. And the reason I came over there was imagine how important healthcare is, not just to our lives, but to our economy. It's the largest part of our economy, almost 20%. And so I said, hey, this feels like a place where innovation can make a difference. But it's different than building a startup because you have, hundreds and hundreds of doctors and hundreds of thousands of patients going through there. And the kind of constraints on innovation are very different than if you and I to start a company and, sell streaming apps to students at USC. The risk profile is very different. We have to, the models are very different. So innovating there is really about thinking a little more tactically, I would say, about how we, once again, improve access, maintain and or even elevate quality and manage cost. And we have a really tremendous CIO at the health system, TJ, and he's really good at thinking about things like, agentive AI or passive listening. So when you go to a doctor, you don't have to have someone taking notes. I think where I'm trying to help is more around what I call moonshots. Is you can squeeze, opportunities at a tactical level, but the challenges around healthcare are seismic. So how do we think in a bigger way so that we're not just solving kind of at the margin, but we're thinking about kind of moonshots or bigger plays that maybe take 5 or 10 years to get there. So I think of my role, and it's still being formulated, so I have to confess it's a little bit of work in process. But I see myself kind of bridging the immediate tactical needs of the patient is bleeding, we must solve their problem from an innovation perspective to how do we as USC Keck health system, USC Keck School of Medicine, and the whole enterprise really become leaders in the transformation of healthcare here geographically and hopefully at a level where we can be a global leader in how we deliver healthcare to the population at large.
Definitely. And that raises a lot of questions for me. I had quite a few
Of course you
questions.
do.
But before I ask them, I just wanted to clarify something. What does your day look like doing innovation strategy in health affairs at USC?
Yeah, as I said, it's still a work in process. I've only been there 3 months. I know what to do when I start a company, having started 9 of them now. But I think we're still figuring out exactly what that is. I can tell you what I'm doing today. As I said, mission is to kind of maybe pull above the day-to-day activities that if you're running a health system or the dean of a school of medicine or pharmacy, what are the bigger plays, both in terms of innovation, but maybe looking for new institutes we could be building or should be building. What are the opportunities to be a leader and aggregate disciplines and new types of research? So that's my job description. How do you get started, right? And as I say, I'm getting started. It's like a new job. And when you work with a big organization, first of all, knowing who the players are on the field. So at this point, I think last count I met 100 people. There are tens of thousands of people at USC. So I can't meet everybody, but figuring out first who to meet and who are the thought leaders and who are the people who have influence, because I don't have it. I'm a matrixed person. Like I don't have those pieces. I'm not the president of those things. I'm kind of the staff person who helps stimulate thinking. So getting oriented, both in terms of organizationally, but also for me, though I've worked at the periphery of healthcare and in terms of biotech, med devices, therapeutics, around building companies. A health system is where you put those pieces together, where they actually touch patients. I've never worked in a health system, so I'm in that kind of steep learning curve. Like I know you have students are going to have first jobs. Is the kind of learning the industry is really important, and learning who the players are within your own organization, but also at the industry, kind of across the industry, who inside and outside of the enterprise are key people you need and should know. So I'm kind of in that stage. I'm working on some projects around business model transformation, thinking about how healthcare is being forced to transform from what has historically been a fee-for-service model to value-based care, where outcomes are really what you pay for. And that's what we care about is healthcare outcomes. You don't want to go to the hospital 10 times and keep ringing the cash register. You want to get healthy. So more and more healthcare providers are being compelled to work in that model, and that model makes more sense. If you're a primary care physician, they want to keep us healthy, but when you're a specialty academic medical center where you do heart transplants and deal with late stage cancer, kind of figuring out how value based care plays in that part of kind of the healthcare continuum is not as obvious. So once again, I'm working with our teams, our chief medical officer and heads of strategy about how do we play there, because we know there will be growing pressure to participate in the healthcare industry in that way. So thought leadership is kind of innovation. It's not all tech. How do you change the business model? And that's super interesting, especially for someone who's new to healthcare. When you think about business model transformation, it kind of touches the entire value chain. How do we get paid? What does it mean to a physician? Where does the care get provided? What are the incentive systems around that? How do you motivate docs who are used to, kind of keeping track of, transactions? What are the analytics that go around that? So it's been a great kind of first project to help me really immerse myself in the world of healthcare and healthcare delivery. And we think about biotech and pharma and all those things, but ultimately it's a healthcare system that impacts our lives in terms of how we receive healthcare. And that's why I'm working there, because I've been building, to use an analogy, I've been building arms, but I've never fought the battle, and the battle gets fought in a hospital or a clinic every day. So it's really been fascinating to see such a high quality institution like, USC Keck at work. The doctors are phenomenal. I mean, some of the best in the world. But there is still a huge amount of opportunity to improve how healthcare is provided. And I'm really excited to learn about that. So learning, thinking about those issues, connecting with policymakers. I also feel here at USC, and I know most of your listeners are at USC, we are in an extraordinary position here in Southern California in terms of the educational institute that we represent. The scale of the institution, the diversity of the schools here, the quality of the students. I have to, of course, flatter you as my host, to brilliant students. But putting that together to achieve impact really requires kind of systems thinking. So the first goal is to figure out who's on the field. So I tell you, in the few months I've been here, I'm trying to figure out who's on the field. And I think I'm excited about, getting to the next phase of how do you put those players together to score more goals, taking advantage or more advantage of the incredible platform that's, at the health science campus with, the med system and all the health science schools. But ultimately, I just literally left the office of the Dean of Engineering and thinking about, biomedical engineering and how that interfaces. I have to be careful not to boil the ocean because you could think about all these opportunities to put, great resources together to help address what is this huge problem around healthcare. So I have to, it's like a kid in a candy store. So many amazing people here, so much innovation, research, so on and so forth. And I think, my mantra is going to figure out what that is and kind of figure out some short-term wins, but also really my hope is if we're doing this interview 10 years from now, how do we further elevate what's going on at USC as a global leader in healthcare?
Very, very interesting role indeed. But one thing that really stood out for me when you were talking about your role was that you mentioned fee-for-service and value-based healthcare. I've seen those terms thrown around very often in the industry, but I'm not sure if everyone even knows about it.
Sure.
So what is fee-for-service model and what is a value-based model? And honestly, what is wrong with a fee-for-service model? Because, it does...
I think it depends. It's all about how people, how med systems and providers get compensated, right? So when you go to the doctor, everyone has health insurance, certainly who are going as a student at USC, and it costs, say $500 to see a doc. The doctor, submits that to your insurance and they get paid. Usually there's some sort of contracted rate. It's $500, maybe the rack rate, maybe they get $300 for visiting you. And if you're seeing them for some sort of illness and you keep going back and they never really solve the illness, they get more tests and like, wow, that, first of all, it's a lot of your time, but ultimately you don't really want to see the doc, you want to get better. And, Medicare, started this where, you start getting paid for treatments. It's called a DRG. And then when you have a certain kind of set of symptoms, they pay a certain fixed amount. And so if that, let's say illness has hospitalization and so on and so forth, and they get paid $15,000 to take an appendix out, making that up, that provider gets paid $15,000, whether you're in the hospital 3 days, 2 days, or 5 days. And by the way, if you come back because the post-op wasn't good, they still get paid $15,000. So in a value-based model, they get paid a fixed amount for dealing with kind of an outcome. And it could be a fixed amount for your being healthy. So I could be, paying a doc network, a certain amount of money to keep you healthy. And if you go to the doctor once a month or once a quarter or once every 6 months, they still get the same amount. It's capitated. So the risk it depends on who carries the risk, right? That's really the big difference between value-based care and fee-for-service. The fee-for-service, every time you go, you ring the cash register. In a value-based model, it's bundled around some sort of outcome. Having your appendix removed and you getting better. You being healthy every month. Versus, every transaction, you could imagine if you had your appendix out, you could pre-op, post-op, every time you do something, there's a cost associated with that. And if you keep going back to the hospital, that gets more and more expensive for the insurer. And the insurer is like, well, we don't want to be a blank check. So they're pushing some of that risk around how the patient gets served to the provider. And the more of that risk is, that model that, it's capitation. You hear words like value-based care. That is who carries the risk around getting outcomes delivered to patients.
I see. Okay, that makes much more sense. So it's about the incentives and value-based healthcare is more customer-centric or patient-centric?
But I would say outcome-centric.
Outcome-centric.
Yeah.
Okay.
Yeah. So,
Okay.
it's trying to get what you care about is getting the person better, not that they, you as a payer, you don't want somebody to keep coming around. And frankly, as I would also argue, as a patient, you also don't want to maybe be spending more time in the healthcare system than you need to get better. But if a doc keeps ringing the cash register regardless, you can imagine it saying, well, keep coming back, whatever, we'll treat you again. But if you're getting paid a fixed amount, you're probably like eager to get that patient back on their feet. And they are kind of accountability metrics, so that make sure that they didn't come back within a certain window or things like that.
Okay, understood. That's much more clear for me now.
But you can think about if you had a system, maybe a good way to think about it. If you go to a restaurant and order a la carte off the menu, versus if you go to a buffet, you can have all you eat. You pay $25, get all the food you want, whatever. You go in the restaurant, you go to have a meal. Well, you go to the buffet, you have a meal, and this is like cafeteria style, like students like that. Right. But if you had to pay for every banana and everything like that, you could ratchet up a big bill. I can tell as a parent who has a college-age son, I'm happy he's on a meal plan where it's value-based meal plan. He can eat all he get. We pay a fixed fee. He eats as much as he can. And as a 6'3", 185-pounder growing, that's a lot of food.
Definitely. And you've had so many diverse experiences, like starting 9 different companies, but all in different aspects of a business, non-profits, for-profit, public, private. So as someone who's worked across all these different segments, how do you stay grounded in a mission while navigating these different stakeholders?
Yeah. And I think about, and I know one of your real emphasis is around career thinking for listeners. And I think there's different trajectories. My wife is an attorney and a litigator and probably the top of her field in the state of California. So she's at, the 99.99 percentile level. So super, super, super expert. When you build companies in different industries, you're not going to be the expert in those industries. But I think what you can do, and what I like doing, and what gets me excited is 2 things. One is, as you can tell, I'm really excited to learn about healthcare. It gets me up in the day. Everybody's like, hey, I'm like, how do you crack the code? And as soon as I kind of get most of the code cracked, I have to go start somewhere else. So that creates an enthusiasm, and kind of that process of learning is fun. But what's the benefit in terms of problem solving? And I'm able, because I've had so many diverse experiences, of the 9 companies, 3 of them are not for profits, and 6 of them were for profits, including a venture fund. And I had, some of them where I was sole founders and co-founders and founding team and so on and so forth. So there's a diverse set of experiences. And the industries are quite kind of diverse as well. But it allows me to look at a circumstance and think creatively of like, what are solutions that worked in other areas that may work here? And I think when you've been in a lawyer for 30 years looking at the same problems, or a healthcare professional, working in a trained world of clinical practice or whatever, you kind of look at the world as is. And I think where people like me who've gone on this journey see the world of possibilities. And we have to be careful because, like in healthcare, it's highly regulated. There's all this complexity, and you could have these beautiful, elegant ideas, and the likelihood of succeeding could be 0. So that's why I'm kind of trying to understand at this point of my involvement in kind of career 9 or whatever flavor it is at USC CAC, is understanding kind of a little bit enough about healthcare so that my solutions can be grounded in some level of reality, without being shackled to the legacy activities, right? So I can kind of look at things in an orthogonal way. So I like being a little bit of a disruptor, saying, hey, we ever thought about it this way? Or kind of, if we see analogies in other industries, how could we do it? And I think any leadership organization needs both those disciplines. Like you, especially in something as tightly regulated and as complicated as healthcare, but having kind of somebody who can maybe ask questions or propose solutions that would never occur to people who are kind of from within the industry. So I'm hoping to do that. I think that it's pretty early in the life cycle, but I really enjoyed starting to learn about healthcare and understanding the prominence and the unique capabilities of our health sciences enterprise. It is really quite extraordinary, and I don't say that kind of as somebody to pump up USC. We have some of the finest clinicians in the world in certain practice areas, and obviously, the quality of the academic institution is second to none.
Yeah. I mean, I personally find your journey so interesting and the way you approach your career. You've picked many different paths and it's given you a very diverse thought process because you've been in so many industries, many different ways to solve a problem. But a lot of students have a similar question at the beginning of the journey. Should I generalize or should I specialize? And you chose a path that required a lot of generalization and also specialization in some degree. So what are the pros and cons of each from your perspective?
Yeah, and I think we talked a little bit about that. Compared, my wife's journey is very, I would say vertical, while mine's been very horizontal. And I think it's kind of know yourself. Like, I get bored kind of easily, and when like dealing with super minutia, and once you get to, that's why I trained as an engineer, but never wanted to be a practicing engineer. I think what I really enjoyed about studying engineering was quantitative methods and a systems view of how things work. And I think to me that has been the most important thing that's carried across, my work is, thinking about how to get things done. I don't want to say in a systematic way, because that means kind of process, but more how all the pieces interact together. Whether it's an innovation ecosystem or if you're a change agent, how you build coalitions. You think about the healthcare system, which is all the pieces. It's the regulations, it's the patients, it's the payers, it's the providers. Those are all interconnected. And you're never going to be a change agent unless you have some knowledge and sensitivity of how the system works, so you can figure out when you turn a dial what type of outcomes you'll get. And I think that's probably a skill that I've built up. When you're doing something, you're a financial analyst and you're working a spreadsheet, you're probably not thinking about how this, what happens to the spreadsheet, who's going to use it, how does that create a kind of a waterfall of outcomes. But in the world I'm focused on outcomes, and ultimately, that's kind of, one of the things I measure myself about is hey, have I made a difference? And we can talk a little about career trajectory, but if you're a hardworking, capable person, and my spouse is successful in her career, we're all going to have, with a certain amount of confidence, we're going to be able to pay the bills. And I think when you're first getting out of school, you're like, oh, I got student loans, I got a car payment. It feels like you're never going to pay your bills. But once you get to a point mid-career, oh, I'm paying my bills, then you're like, where are we going with this? What does it matter? So I've been very much focused on, what is the impact of the work that I do? And over time, the balance of those two kind of imperatives, can I make a living versus, am I doing something in the world that's going to make a difference? The weighting of those two variables has moved over time. And today it's 95% impact. And that's why I chose to come to a health system here at USC. I feel like there's very few industries where innovation thinking could have a kind of seismic effect on a large number of people, and wanting to kind of pursue that mission on a platform like USC was compelling. I think where the jury is out for me every day is where are those leverage points, and are there things that I can do to make a difference? So, kind of over time, when you first, once again, graduate, it's like, oh, I need a job that pays the bills. And I get that. I also think as you, once again, get comfortable that you're going to pay your bills, your car insurance, you're going to be able to eat. It's certainly the more you do things that are your personal passion and are aligned with your value system and your mission, the less it feels like work and it more feels like you're on a journey of discovery and impact. And that's what I have been fortunate to be on for the last 20 years of my life. It's kind of a luxurious place to be. Like if you're living on the street and can't feed yourself, the idea of changing the world is probably not top of mind. But I challenge every person to examine their own kind of professional trajectory and think about how the priorities should evolve over time. And I would say, if you have mid-career people, if they're not evolving over time, I would challenge them to do some sort of audit about, your circumstances are different. And should your behaviors reflect the circumstances as they change over time? In mine, I do that continuously because I'm getting a little later in life. I still have time to do things, but we need to be intentional about how we spend our time because that's the most precious asset we have. So reevaluating and kind of resetting priorities consistently, something I've always done. So I, once again, to kind of think about that journey, I think when you start initially, it's probably going to be more tactical and more focused. Then the question is, where do you go? You can become that absolute expert, and that tends to be something technical, computer coder, lawyer, doctor, some sort of technical discipline, financial analyst. Or you could say, hey, my mission is more horizontal. Mine's about impact. And, that's been my journey, building up a set of insights and trying to, build up tools, relationships. And I think it's really important to not just talk about technical skills, but the social networks and the communities of influence that we build up over time. Because who we know and how you can rally those people around you are really important into amplifying impact. You're a financial analyst, you probably don't need to amplify impact. But if you're a change maker, an impact champion, you can't do it alone, right? That is, not the way to change the world. So that's a skill that I've had to build up over the last 25 years. And as an engineer, we don't typically think about social influence. But when you're a system thinker and you think about, wow, I have a lot of good ideas, but no one's listening, or I can't move a point of view, or I can't get the right partners to participate, you start to come to the conclusion that our abilities to create spheres of influence that are driven by other people are important to creating not just a ripple, but a tidal wave of change.
Definitely. This is very important advice. And on the topic of knowing yourself, what would you say is your North Star when you're building something, be it a fund, innovation hub, or a regional strategy?
Yeah, and the answer hopefully is somewhat obvious from our discussion. I'm a huge champion of Southern California. I love where we are. This is not a perfect place, but a very 20, 25 years ago, this personal mission to create impact in community and society, that's my North Star. It's like, are we doing something not just helping us, me individually, but is it helping others in our community succeed, get healthcare, commercialize science, strengthen the fabric of the region we live in? That's what gets me up. That's my North Star. It's not, it's like I enjoy work. I enjoy the intellectual challenge of it. But I'm mostly thinking about the things I can be doing to improve the circumstances of the community in the region that we live in.
Yeah. But looking at it in terms of, you seem very sure of your career path. I mean, there's a very obvious string attached to everything you've done, and it's all about impact and impacting the community in a great way. So were there ever moments during your career where you were reconsidering your choices and not sure about what to do?
100%. In I think, like many people who were young in their careers, I just wanted a good job. I wanted to make a decent income. I wanted to be challenged. But kind of the impact calculus was not something that was even on the scorecard I was using. But then I realized that, if you're going to work hard and, be diligent, be smart, be creative, why not choose industries and opportunities where the work you're doing is going to have societal benefit? And so I kind of wish I had made that kind of leap. I think we're like, oh, you're a capitalist or are you an impact person? Are you serving, homeless orphans, or are you a Goldman Sachs banker? And I think, those stereotypes do exist. They're kind of crazy capitalists, and they're people who, will give up their lives and their own quality of life to serve others. And I'm not here to judge either one of those views. But, I think there's the middle ground where you can have a very satisfying, fruitful professional career, but choose, I know you're focused on healthcare and biotech and providing, services, skills, tools, capabilities to make humanity a healthier place where we live longer and have higher quality of life. Why wouldn't you do that? So I would just say, if you just like making money, go for it. But I also think there are a lot of great impact roles where you can, do well and have, a high quality of life. You may not have a jet and a yacht. But I tell you, I don't think those things necessarily add to the happiness quotient. So I kind of wish I had found that kind of calculus, put that in my own thinking earlier in life. It took me, till I was more middle-aged to say, hey, I was doing it on the side. Like, oh, I'm, working as a capitalist, but I'm going to go volunteer, at the homeless society, or going to go do work around the community. But I do think you can choose a career path where those things are more tightly interconnected. And I think healthcare is actually a great place for that. Education is another one. You can make more money in educate. Certainly educators are not as well compensated given the role they play, but the idea of helping the next generation prepare themselves for the world and giving the tools they need and the skills they need, that's an impact job too, right? So I think there's careers where you can have a double bottom line, which I think is terrific.
Yeah, a lot of pre-med students actually come in with a high impact mentality with treating patients on a day-to-day basis. But I've seen a lot of students move out of pre-med, but they still want to make impact. And me too, personally, I want a high impact career. But one thing I've realized specifically with pre-med is that it's a lot of work to impact one patient, whereas in another high value or another high value position, I could do the same thing, but at a much larger scale. So what are your thoughts on students going to the pre-med route for a high impact journey versus, would you encourage them to choose a different path, or would you say keep going at it?
So let me maybe answer that with an analogy that's closer to my own experience, because it wasn't pre-med. Part of my thinking and the reason you start, co-found, almost 10 companies, is you believe in what I call, institutionalized problem solving. That's what entrepreneurship is. Like, there's a need, and you think about what the product is, and you build a product around a need. And if there's no need, then no one buys it. So I love that mindset, because I think it's one around kind of plentitude. Like, let's grow the pie rather than just chop the pie up, or frankly, or even worse, just complain about the problem. Let's solve the problem. And so impacting kind of this innovation, entrepreneurship are kind of the two levers I pull the most often. And because I enjoy that and think it's such a great way to improve our kind of collective status, and not status, but situation in the world, you could start companies. And I started a number of companies. And then I'm like, wow, but only doing that one at a time. And it was the next realization, well, why didn't I run a venture fund, which I did? So why didn't I have a portfolio of companies? So maybe the analogy is rather than being a doctor, you create a practice or something. So then we had, whatever, a couple dozen companies. Then I spent the next 10 or 12 years thinking about ecosystem. And the reason I did that is that if you were thinking about, let's say, even on the campus of USC, you could be an entrepreneur starting a little company, you could have a little venture fund here. But if you're kind of building the entrepreneur network here and bringing in, VCs and mentors, and you're kind of running an organization that supports the community of entrepreneurs as a collective, more so than the ones you could invest in, because frankly, a lot of entrepreneurs wouldn't be investable, but you could help them become more successful. So that had more scale to it. And that's, I spent the last 8 years before coming to USC running and building the Alliance for Southern California Innovation that was just focused on how do we create more infrastructure and connective tissue and support capability to help innovation champions succeed in their innovation journey and their entrepreneurial journey. So when I think about your question about impact, and I have a lot of huge respect for people who are medical doctors. I had an experience last summer at a friend's 4th of July party. We had a couple hundred people, and someone was choking. And there was someone there who was trying to administer first aid and was not being successful. And I could see the poor victim was about to expire. And I moved this person aside and was able to save the person. And, I would have to say I did save that person's life. And it kind of is a profound moment. It's probably more so for him than me. But it is kind of... I can see people being called to that, the ability to kind of intercede and kind of change on someone's life trajectory, even one life at a time is pretty powerful. So I wouldn't discourage people. Yeah, wouldn't it be great if we can solve, all hunger in Africa or something like that? That's a great noble cause. But, saving one life is an incredible kind of responsibility. And so I wouldn't diminish kind of the impact of that work. If you're creating a pharmaceutical or, small molecule bio or whatever, going to biotech or biopharma, that, you can impact a lot of people's lives in that way. So neither one of those is better than the other. I think when I look at those two careers, and I know a lot of people who have been in the biopharma space, and they're much more scientists, and I think there's a certain mindset that goes with being a practicing physician, and do you have that mindset? So I think it's what fits for you, right? And obviously it's different being a general practice physician than it is maybe a highly specialized surgeon. So I think kind of being introspective about who you are, and this idea of I only can save one life at a time I don't buy it. You save one life at a time, you're doing a damn great job for society, and you deserve congratulations. So once again, figuring out the fit that's best for you. And I wish schools did a better job, kind of. And I don't know how USC does, but around creating frameworks for introspection around who you are and how your career aspirations reconcile and fit with what you hope for and what your value system is and what makes you happy. So setting aside whether you were going to be a doctor or anything, I just think that work is very important. And I think it's, universities are good places to do that rather than just saying, we have a bunch of people coming in and I always want to work for Goldman Sachs and go work for Goldman Sachs. I mean, no one's going to tell you not to. But, as I say, go back to what I said earlier, if you're at USC and you're doing well academically, it's a pretty high certainty that you're going to be successful in anything you choose. So why don't you choose something that is most aligned with who you want to be and what your aspirations are? So I think it's really important, and I think about this show setting aside biopharma, like really taking the time to inventory what makes you happy and how you want to work. Being a lab-based scientist doing biopharma research is different than interacting with patients. So again, there's no right answer. The question is, what's the right answer for you in going through that journey? And the good news is, especially as your kids come out of college, you're just trying to get in the game. And it's great to your first position, like positioning yourself well and thoughtfully out of the gates is helpful. But you have time to pivot and navigate if it doesn't fit. I was just with a gentleman who told me he was an entrepreneur and has dedicated a lot of his time in the last decade to helping our unhoused community here in Los Angeles, because he just thinks it's important for our region to address our homeless issue. And he told me his wife, who's they're not much younger than I am, so probably mid-50s, that she's starting her third career is a L1, a first year law school student. So sometimes people take time to figure it out, or industries change, right? This is you imagine if you were an animator 50 years ago versus an animator today, and the skills are super different. So industries change too, and you may not want to change with those industries. So our careers are fluid, and once again, I think we should be mindful about our own enjoyment level and where industries are going, and be adaptive over our careers.
I really agree with you there. Knowing yourself would be the most powerful tool from the get-go to navigating a truly satisfying and successful career. Mm-hmm. And I agree with you. There should be something at schools that helps students do that, because it's really very confusing when you're navigating through classes and you don't even know who you are or what you want to do.
And who you want to be. I think
exactly.
I think it looks very kind of clinical, like, oh, here are the jobs, you want to be a consultant, you want to be X. So I do think, not to get over, it's weird because, it sounds very touchy-feely, and I'm a mechanical material science engineer, but I think, with age comes a little wisdom, and asking these questions about yourself. And, there's no right or wrong answer, but I think it's being mindful and kind of having a certain level of intent versus just getting sucked along. Like, oh, well, take a second moment. Think about, hey, do you really want to do it? Why are you doing that? Are you going to be happy doing that? And I know it's hard in some cultures too. It's even more limiting in terms of like, oh, here's the formula. You better go do X. You can imagine I'm not a huge fan of that formula, because I think fundamentally, we all want to be the best version of ourselves. And you have to know yourself first in order to figure out what that is.
Definitely. And, like you said, with age comes wisdom. So knowing everything you know now about yourself, what is one piece of advice you'd whisper to your 19, maybe 20-year-old self?
Yeah. I think maybe just what we were just talking about is put the playbook aside. Like we all come to the world with some sort of playbook when we're in college, and we're talking with this podcast about professions. So there's we have some sense of who we think we want to be, and there's nothing wrong with that. But I'd also take a moment to challenge those assumptions and say, liberate yourself for a moment, and say, what makes me happy? What am I good at? What do I want to be good at? What type of people do I want to be with? And then try to figure out what that means in terms of careers, and industries and companies, stage of company. Like, I worked in big companies and now back at USC, which is a big company, so to speak. It was a lot of fun being in a very small, agile company the downside is like, half the time we weren't sure if we were going to get a paycheck, but that was okay. Like I like the being on the roller coaster. It was very intense at times, but it was, in big companies, things go slower. It's a little more bureaucratic, hopefully the paycheck comes regularly. And I spent a lot of time talking to people who want to be entrepreneurs. I love entrepreneurship. I spend half my time convincing many people it's not the right thing for them. What is your risk profile? Like, how do you deal with uncertainty? All those things. Do you have a real passion for what you're doing? And once again, my bias is to enlist more people in the entrepreneurial journey. But I also think that my kind of more important bias is that I want people to be true to who they want to be. So kind of asking them about that question, knowing that I would love everyone to be entrepreneurs who are going to change the world. But that's not right for everybody. It's actually not right for most people. And I think that's true about a lot of kind of career choices. And sometimes, sort of, asking yourselves the question, and you're probably going to be only half right anyway. And when you get there, continuing to ask yourself, like, how is it going? Is it the company or is it the industry? Is it who I'm working with? So I think we have to take ownership for our own career journey and be proactive about navigating that rather than just getting stuck in the flow. And I think people just kind of get passive about it. So when you go up and every day you're like, what am I doing and why am I here? Then you can be more proactive about turning the tiller and navigating that career journey because you're intentful about finding destination rather than just going with the flow. So I try to make that. I try to audit myself pretty regularly, just because I feel like this is precious, and I want to make sure I don't not blow it, or like make the most of it.
Yes. And you've had a very long and successful career so far, but I want to take you back to your days at university.
Mm-hmm.
What was one resource at university you wished more people used that was very underrated?
Yeah. Wow, that's a great question. It's hard because I probably didn't know what that resource was. But I do think, I'm hoping, once again, I don't know enough about what USC has in its career center, but the sense of kind of calibrating yourself before you start locking in on a career journey is really important. And I'm not talking about, going to, recruiting meetings and, recruiting days, and those are tactical activities. It's the pre-work before that. So I kind of feel like a lot of us poo-poo that. We have a playbook that we're going to use. I think it's worth challenging some of those assumptions and taking advantage of resources that allow you to do that. And for me, I think the other resource, like we had it was pretty small at the time. I went to Dartmouth College. They had the Jewett Center. It was like a kind of social impact center. And honestly, it was, those pretty traditional engineer, and like they were kind of more crazy, impact people who were going to teach for America and live in it. And I'm like, oh, that's not me. But I kind of felt like I should have spent a little more time over there. But I also think, I know they've progressed in terms of social impact. Like the world of social impact is much bigger than we think it is. And I think if you have any desire to have more than just a professional career, but want to leave some sort of imprint in society, exploring what it means to have social impact and at least opening your eyes to what those possibilities are, and thinking as you make career choices, can I have that, look for that double bottom line of having a high quality career, but also doing something that improves society. I think that, exploring that would probably be worthwhile.
Okay, I see. And, you've been in a lot of leadership teams as well, where you've had to hire and fire teams and also build teams from scratch. What are the biggest blind spots students have when they're trying to break into recruiting into a company, or, as someone hiring? What are some blind spots most recruitment or most candidates have?
Yeah. It's funny, I've hired, as you can imagine, thousands of people. And, I fired not nearly that many, fortunately. We do make hiring mistakes. And, just on that topic, I 99.9% of the time when it's a hiring mistake, it's a match issue. It's not someone, is a bad person or stole from that happens sometimes. That's super rare, but often it's just not the right place for the person. So, and I think hopefully as a manager, when you get to that circumstance, you have helped the employee come to that realization at the same time as you have, so that they know. Because I think we want employees to succeed, and turnover is very costly to any organization. But when I think about hiring, I'll just tell you a few faux pas things not to say. Like if you're people who, especially in the world of startups, remember I spend most of my time in startups. So when you're building a startup, especially an early stage startup, you're borderline maniacal about the work you're doing. You have to be. It's very hard. You're not getting well paid. You have to believe like this is really important work. And you have a candidate comes like, oh, what are you doing? Oh, that's cool. Why do you want to work for us? They say, oh, well, it's a lot shorter commute to your business than where I'm working. Like no one wants to hear the reason you want to come work for me is that your drive is shorter. Especially if in a mission-driven organization, you want to hear like, oh, I love what you're doing. I love the impact you're having, really kind of connect with the people who are there. So I think kind of understand the ethos and culture of an organization is as important, if not more important than like the technical skills. Who works there? Why do they work there? And being mindful of that and don't, shoot yourself in the foot. And so sometimes I'm like always surprised, like, like we're hardcore, like we're, saving humanity. And you just think like, this is, something petty that seems, inappropriate. I think, technical skills are great, but, in the world of AI and it's less about what you know today. It's more around your ability to learn and evolve your skills over time. So I think, it also depends on what role it is. Like if someone's, super hardcore quantity and needs technical skills, you definitely will go through a process where people are going to vet those. Most of the things I'm hiring are more business functions. And I think, I look for curiosity, creativity, tenacity, passion, motivation, like the soft skills. And if someone's super motivated, then I don't have to manage them very much. Like I'm sure you worked in volunteer teams and there are people who are super motivated and they're always like checking in and then the people you're like, how come they haven't done the work? So I think, showing and demonstrating that you're a self-starter and a doer. And that I think part of it goes back to what we talked about earlier. If you're interested in the work in the company, then it doesn't feel like work. And I really worked and tried to position myself in my career to the greatest extent possible is to make my work environment, my work kind of something I care about. So, I like working on the weekends, not because it's work, but because it's like stuff that I'm doing. It's my passions, my interests overlap. And, bosses like people who are thinking about the problem outside of work, not that we, work-life balance, it's different now. It's like so merged. Like, oh, you go to work at 8 a.m. and you're done at 5 p.m. Well, my life is intertwined. It just, with the internet and connectivity, like it's hard not to be intertwined. But I also want to know that in your, priority part of your thinking, you're interested in succeeding in your role in the organization, in helping the organization succeed as a whole. So kind of being self-motivated, I think, is really important. So when someone comes to interview, I like to show the fact that they've done the homework. First of all, getting an interview, kind of articulating your interest level and your passion and interest, I think goes a long way. If you're coming from USC and you've done well academically, like they're going to know that you're going to be able to do the technical work. They're looking now on how well you're going to fit in the organization and how much effort you're going to take to manage and motivate.
Yes, I know you briefly also mentioned AI in your response
Yep.
and how that's changing a lot of things. With AI and digital health accelerating now, where do you see the biggest ethical gray zones, and who do you think should be responsible for drawing the lines in these cases?
Well, I'm a big believer that AI is will be a force multiplier. I use AI regularly myself, and I think it will have real application, is already having real application in healthcare. As I mentioned, whether it be automatically, passively recording notes and also interacting through agents and helping people manage their healthcare journey, looking at data. There's so many applications in healthcare, and I think it's going to be transformative in healthcare and many other industries. I think doctors have they're charged with the care of a patient, so I think still having clinicians in the loop, so to speak, is really important. And there's lots of studies about is it kind of a co-pilot type scenario and how does that work? I think when it comes to precision medicine, I think that's going to be super interesting. There's lots of potential if you're kind of in the biopharma space, making sure people are getting medicine that's tailored for them and thinking about how combinations of medicines work. I do worry about genomics a little bit in the sense of as we unpack people's genome, we all have risk profiles around us, and some people, if we know too much about them, will be uninsurable, right? It's like, that feels like maybe not the right thing. So I do think there's boundaries on the use of AI and information around health equity. But I'm very bullish. That's one reason that's why I chose to come to healthcare, because I think the opportunities for innovation, especially in the advent of AI, are going to be extraordinary. I think if we're want to go back to our conversation 10 years from now, if AI hasn't helped transform healthcare or been a driver in the transformation of healthcare, and we need that, as you and I were talking about earlier, about moving from a fee-for-service to value-based care. It's going to drive, we need to be more mindful about how we deploy the health system and the interventions in using AI to help kind of figure out that match and kind of manage that progression. I think it will be critical to make that happen. So I'm very bullish. I have concerns about AI and other ways around deep fakes and things like that, but less so, in healthcare. I think, privacy is important, things like that. And I think, it's hard because I think our things like our medical schools are still trying to figure out what the future is, as we are. But I think it's going to have important impacts around how we educate future clinicians. So we don't know. It's like we got to educate them. We don't know what the future is going to be, and it's moving very quickly. So it's a scary time from the standpoint how fast things are moving. But I do see huge amounts of possibilities, and I think it's going to be a tremendous net positive.
I completely agree with you. There's a lot of things to be concerned with AI, but there's a lot of things you can use. There's so much potential with AI. But changing topics slightly, from Innovative Pasadena to the Alliance for SoCal Innovation, you've championed a lot. You've consistently championed community building, and in a world driven by digital scale and global impact, why does local innovation still matter?
Yeah, as I mentioned, I love Southern California, so I want all the cool people and cool stuff to be happening in our own backyard. I think, why not be in a world where the people you interact with every day are the champions and are at the tip of the spear in terms of transforming industries. It's so fun for me to be here, and also I live down the street from Caltech, and they're kind of a different breed there, but they're extraordinary in their own right. So I get stimulated by being in that environment. So that's a selfish answer. I also feel like Southern California is a very expensive place to live, and if you are at the kind of leading edge around transformation and innovation, I think there's wealth to be created, and we need people who have high quality jobs to sustain the quality of life here and the vibrancy of our communities. So I think there's kind of an economic development aspect to this as well. So that's why I like going to think about it locally. And, I'm very torn around the changes in behavior as a result of COVID with respect to kind of remote work. It's super convenient in places, so big as Southern California, we can correspond with people across the globe. But I would argue like the conversation you and I are having face to face is not going to be the same as if we're doing this on a Zoom call. So I think physical proximity in terms of connection making, collaboration, is still very localized. We have to be in the same place. It doesn't mean we have to be in the same place, 7 days a week or 5 days a week. But I do think, human minds in a more confined space with, whiteboards and solving problems, I think continues to be the best mode for breakthrough thinking and through relationship making. And as I mentioned, like that collaboration is critical to problem solving. I also think that, remember I mentioned that community building is a force multiplier. It's a lot easier for me to feel like we have a connection when we spend an hour together versus, how many Zoom calls we have to feel like we actually know each other. So physical proximity, I think, is still a really important dimension to innovation and competitive advantage.
I completely agree with you. Yeah, there's a lot of, technology has made it very interesting. Apologies, I'll just ask it again. So I completely agree with you in this case. Technology has made everything so scalable that I could be in India and I could talk to you right now, right? But it's very different when you're sitting together at the same place, and it makes that connection 10 times stronger in a much shorter time. But switching gears here, looking ahead, more forward, what excites you most about the future of Southern California's innovation ecosystem, or on the opposite side of it, what keeps you up at night?
Yeah. On the exciting side, I think there's a unique and incredible opportunity for Southern California to be the healthcare system, not just USC, but this region across the globe. We have, 20 million people here in Southern California. We have one of the most diverse populations, which is really important in terms of figuring out how to solve healthcare problems. We have a number of fine healthcare systems, of course. Keck USC is the best, but whether, UCLA, Cedars, and, the healthcare challenge is so expansive. I don't feel like, though at times we do compete, I feel like the opportunity to collaborate and kind of improve how healthcare is delivered, both in terms of access, quality, and of course, cost, can happen here. So I do think there's an incredible opportunity. Once again, going back to why I'm here, I saw that and I'm like, and I want this to happen here. I'm not saying it's a given, but if people like me and other people who share that vision, kind of enough of us believe that, then we have a real chance of making that happen. And I look at, my boss, Dr. Steve Shapiro, believes in that as well. And so I'd love to be part of that kind of coming together in nexus of breakthrough thinking for an industry that's so important. So I'm bullish that, we can make that happen. I also think, I spent a lot of time looking at aerospace and defense, and I think there's an incredible renaissance going on in that sector. You don't have to go too far to go to the Gundo and South Bay and all those things, and you look at private space. But I think, with changes in administration and how, we actually solve those types of challenges, whether it be, going to Mars or space travel or even defense, it doesn't have to be, the ultra primes that take 20 years. I think it's almost like the world of software when we had cloud computing. You actually can create incredibly innovative breakthrough technology, hardware in a much more entrepreneurial way. And our healthcare, or not healthcare, I'm sorry, our aerospace infrastructure is still sufficiently robust. And I, just say meeting with the dean of the engineering school, and I look at, we produced more engineers than any part of the country here in Southern California. So I think that's going to be an incredible renaissance, and it is already happening in an incredible way. At the downside, I look at, here we are in Southern California, and I think the media entertainment world has been our, number one, exported staple. And I think with the development of AI and, how content's going to be created and all these things, I think there's going to be a pretty radical transformation about what role talent plays, how content is created. And, when you have some radical dislocation, it's, the leading incumbent is always the one that's at most risk because there's, your best case outcome is the status quo. So I think we're going to see that industry change. And I think that's going to be difficult, obviously, for the people in that industry, but also, not great for our local economy. So I'm hopeful that these other kind of sectors will become more diversified. And it's honestly like the entertainment industry, last stat I saw was somewhere like 5 or 10% of our economy. It's not huge, but it's certainly the most visible. So I'm think industries ebb and flow. It's important. Like you can't be a one-trick pony, and I do think we have other capabilities here, and we have great institutions like USC and UCLA and Claremont colleges, so we would produce a lot of smart students here. And I want to make sure we have jobs for them so that if they like it here, they can afford to stay here. And that's why I kind of look at this innovation kind of life cycle of great companies, great breakthroughs, great value in ecosystem, great jobs. People can stay here. So anyway, I you can't take a future for granted. There's enough pieces in motion that I believe we can continue and have a real opportunity to be continue to be a great place to live, work, and play, and have a vibrant economy. And I know it's going to be difficult in the short term. Like we have the largest export-import harbor and ports, and I already heard that with the tariffs that 30% drop off in volume. So that those things come and go, and there will be pain in some of those kind of movements. But I'm hopeful that we have a diverse enough economy here and enough kind of emerging sectors that can fill the vacuum.
Yeah, and your response is why your job is so important currently, because our generation depends on you to make sure that we get into the right places and we have a future to build.
No pressure.
Yeah, definitely no pressure.
Yeah.
But my last question to you for this episode is, if there's a student who wants to do exactly what you do, what piece of advice do you have for them?
Well, my career has been organic, and it's at times people are like, oh, it seems almost random, but they're kind of like a set of connected Venn diagrams. Like one thing led to another, and it's been an exciting journey. And I think I have this incredible appetite and curiosity, I spend too many hours of my life in the professional world, so I want to be engaged and interested. And that's both in the topic of the work I do and the people I spend time with. And I'm very, explicit about making sure that those circumstances are the ones I want. So it comes about understanding, where you want to go. And it doesn't mean like I want to have this specific job, but what is the life and what is the playing field you want to be on, and who do you want to be on it with? And then kind of as you build network and find opportunities, you kind of pull these threads, and you're always a little bit surprised where you are, which makes part of the fun. But it's been a journey, and I'm excited to be here at USC. It's been fun having students around, and I really love that. I'm at the health science campus, so we have a lot of older students here because it's mostly grad students. It's always a pleasure to come to the main campus and see kids running around skateboards and spend time with you. So it is fun for us for people like me to be involved with the next generation. But I take what you said very seriously. Is I feel like folks who are in our stage of our careers, who are champions for Southern California, have a certain obligation to help craft a environment, a set of circumstances where you all can have a very meaningful, high impact, healthy, wealthy life here in Southern California. So I'm going to do my bit to see if our vision of being a global leader in healthcare innovation coming out of here in Southern California, with Keck USC playing a major role, can be part of that formula for the future.
Yeah, well, Andy, thank you so much for your time. That was absolutely great. I learned a lot, and I hope our listeners learned a lot too.
And that's it for today's episode of It's Bigger Than Biotech. And if there's one thing that Andy reminded us of, is that career paths aren't meant to be linear, and some of the most impactful work happens at the crossroads of disciplines, communities, and generations. So, whether you're building a company, joining a team, or just figuring out where you belong, don't underestimate the power of curiosity, civic mindedness, and long term thinking. If you enjoyed today's episode, share it with someone who's figuring out their next step. And as always, follow us on Spotify, Apple Podcasts, or wherever you get your biotech inspiration. Until next time, keep building, keep questioning, and remember, it's always bigger than biotech.